A warm greeting to one and all. This research proposal explores novel ultrasound targeted microbubble therapy for ALS, amyotrophic lateral sclerosis. So, what is ALS? It is a motor neurodegenerative disorder which is characterized by muscle weakness, paralysis, and death within 2 to 3 years of diagnosis. Now, the mechanism of the disease is that it's mainly happened due to protein aggregation, which is our topic of interest, neuroinflammation and oxidative stress, excitotoxicity, etc. Next is the conventional method of drug delivery. Now, in conventional method, it's very invasive, painful, risk of infection like meningitis, and also intrathecal route of administration is very difficult for the patient. So, we will be using a new technique called UTMT, that is ultrasound targeted microbubble therapy. So, in this technique, we will be intravenously administering protein or lipid shell microbubbles, and along with that, we will be using low intensity focus ultrasound so that it will be causing oscillation or stable cavitation over the endothelial tight junction. As a result, the tight junction will get loosened. So at that time, the drug can suitably penetrate to the blood brain through the blood-brain barrier. Key mechanism include tight junction disruption and transcellular transport. Next is collaboration with UTMT and ALS therapy. The conventional form of ALS therapy by using riluzole, edaravone, tofersen, all these drugs are having limited blood-brain barrier penetration. So, how about incorporating this technique with ALS therapy? Obviously, it will be synergistically affecting the crossing of blood through the blood-brain barrier. So, we could collaborate UTMT with ALS therapy. Now, let's move to our topic of limelight, CMA, that is chaperone mediated autophagy. It's a selective lysosomal degradation pathway. So, whenever our body is producing any kind of misfolded protein, it's usually being digested by the CMA mediated autophagy. Now, the dysfunction of the CMA can be due to aging, maybe due to the protein aggregation of TDP43 or mutant SOD1, etc. Now, how we could enhance the CMA, that is chaperone-mediated autophagy? It can be done by upregulating a receptor called LAMP2A receptor. There is a specific receptor called LAMP2A receptor on the surface of the lysosome. So, whenever a patient is having ALS, usually this receptor is clogged by means of this misfolded protein. So, how we will, upregulate that by increasing the number of receptor on its surface? For that, we have to use gene therapy. So by using AAV9, that is adeno-associated virus, we could enhance the upregulation of this LAMP2A receptor by encoding the gene necessary for the receptor along with this AAV9. So this AAV9 basically acts as a vector which carries this particular gene towards the site-specific region. Now, what's the advantage of incorporating this AAV9 to this, the gene coding for that receptor to this AAV9? Obviously, it will specifically reach that target. And if it specifically reach that target, obviously it could replicate along with the origin of replication of the DNA coding for that particular receptor, right? Now, the next question arises about how we will incorporate this particular vector to the microbubble, because our ultimate target is to deliver the gene or the drug along with the microbubble therapy, right? So for that, we could attach AAV9 to the microbubble using a technique called biotin avidin. So biotinated AAV9 can be used to incorporate with the microbubble. So by this combination, we could use AAV9 with the micro bubble. Now, next is towards, rather than going for sophisticated equipments for the possibility of UTMT, we could already use the existing MRI technique with ultrasound machines for this UTMT technique in therapy for ALS patients. Now, it can be incorporated by two techniques. One is called transducer integration and the other is acoustic coupling. So, by these two techniques, we could modify the already existing MRI machines for this UTMT therapy rather than going for highly sophisticated instruments which are very costly and which are not that much affordable for us. So, as conclusion, the UTMT, that is ultrasound targeted microbubble therapy for ALS, is a very critical necessity because it will help the patients who are very suffering and very helplessness with this disease. So, by adapting the existing MRI machines with the ultrasound system, we can overcome delivery barriers, amplify drug efficacy, etc. So, that's so this was our educational project and proposal.